Hello, it is with great honor and satisfaction that we are reporting the results for the training course on healthcare for persons deprived of freedom. The Federal University of Santa Catarina, through its Department of Public Health in partnership with the Ministry of Health, promoted the first awareness-raising course for the healthcare of persons deprived of freedom and the dissemination of the new healthcare policies on the subject. The WHO stresses the need for adequate and permanent training for health professionals who work with the population deprived of freedom, for they face a peculiar field of action. For this reason, public health policies were structured to meet the needs of Brazilian prison system, providing for the implementation of healthcare teams specifically created for prison institutions. Considering this context, we have developed a training course for graduated health professionals who care for the freedom-deprived population, not only those working within the Brazilian prison system, but also those in the national primary care health system. Based on the challenges faced by the health professionals who work with this specific population, we chose the problematization methodology for this course. We organized it in 5 modules of 15 and 30 hours, addressing the primary prison health concerns. The main objective was to promote a place where health professionals could ponder on this subject and understand the consequences brought on by the changes on prison health care policy, as well as to encourage the contribution of these professionals within this new reality. We designed all 5 modules with innovative features and thought them out in detail to encompass learning on the following subjects: public policies in healthcare of persons deprived of freedom, acceptance and humanization in management practices in healthcare, healthcare work process management in penal establishment, healthcare of women deprived of freedom, and healthcare of men deprived of freedom. In order to offer it as an e-learning course, we used the university's open-source virtual learning environment, which we carefully configured so that navigation could be quite easy and intuitive. For an even easier access, registration is available directly on the course's website. Each module had a set of diversified educational resources and standardized access, as well as a book in PDF format, so that professionals could study even without an internet connection. Having the assessment system in perfect sync with the methodology used, the evaluation activity covered 2 distinct purposes. First, to be a formative assessment, enriching the learning process through feedbacks. Second, to be summative, providing the necessary scores for the participating professional to complete the course. In each one of the modules, the professionals had access to media library, tutoring, and supplementary media. They also had the option to leave their opinion about the quality of the educational resources and services provided, which made it possible to gather valuable information about its acceptance. The course has had great acceptance, reaching nationwide public and showing a greater level of adherence when compared to courses of this nature, due to the large demand of almost double the initially expected 1,500 students. We have been adding extra classes to meet the constant demand. Professionals from areas other than healthcare were also requesting to attend. Therefore, we expanded acceptance to professionals from 10 different working segments, which further increased the comprehensiveness of our course. As a supplement, we developed structured content presentations for in-house training. Along with the course book, these presentations are available to professionals interested in extending this knowledge to their working teams. We developed all the educational resources following the university quality standards, with the participation of multidisciplinary staff and hired experienced e-learning professionals. Our consistent course of great acceptance was possible because of an outstanding production team coupled with an exclusive tutoring support. For details and registration, go to www.saudeprisional.ufsc.br.